We have a lot of states where Republican governors have not been able to pass a plan through their legislature, but they've at least put a plan forward. Places like Wyoming and Tennessee, very conservative states, those governors recognize that a lot of their people are suffering and need health insurance coverage. And so they put forward their own plans to expand coverage. And it's important in North Carolina because you have 500,000 people who need affordable coverage and who make too much to get Medicaid. Medicaid does not currently cover all low-income people. If you are an able-bodied adult without children, you don't qualify for health coverage. So if you get laid off at the factory and you don't have kids and you make no income, you don't get Medicaid, you don't get anything. You just go uninsured. And a lot of people are dying because they delay that care and then they find out too late that they have cancer. And so that's why it's important in North Carolina, because those folks who got laid off at the factory or who are working in retail or construction or independent contractors don't have health insurance coverage, and Medicaid would cover them. They could get the care they need, the preventive care they need, and that would really bring down costs for everybody in the system.
Officials with the McCrory administration's Department of Health and Human Services have sort of been talking a long time, for months and months, about coming up with a plan. It seemed like a foregone conclusion it seemed obvious that they wanted to eventually expand Medicaid, and the governor's sort of been all over the place.
That's right, yeah. So the governor said he was waiting for this Supreme Court decision, and so now we have the Supreme Court decision. Then when he was asked in the media about does he support expansion, he said it's complicated, it's not about being just for or against it. But it is. I mean, it's actually simple. You're either for covering the 500,000 people who need coverage or you're against it. Now, if you are against it, we'd like to know before 2016, because a majority of North Carolinians support expanding health insurance coverage, and he needs to be held accountable. If he supports expanding coverage, then the question is, does he just want to simply expand Medicaid, which we could do efficiently in North Carolina, or does he want to come up with his own plan? And if he wants to come up with his own plan, he needs to release it. Let's see the plan. Governors all over the country, Republicans, have come out with plans to cover the uninsured. Some use private health insurance, some use Medicaid. It brings billions of dollars to the state, but you got to put something out there. And he hasn't put anything together that we've seen, and he has to be out there putting out a plan, or we can't move forward. And so, he's either for it or against it, and it's real simple.